Welcome everyone to the third event of our 5-day virtual Morehead-Cain Alumni Mini Forum. We're holding one event each day this week, and we hope you'll be able to join us for the final two events tomorrow and Friday. This afternoon, we're featuring one of the most popular offerings from our regular alumni forums and from our virtual speaker series too, a 7 Talk. And we're delighted that Amir Barzin, class of 2006, has accepted our invitation to be the one and only 7th speaker of the 2021 Alumni Mini Forum. Amir, thank you so much for saying yes and for being here with us today.
Thank you guys so much for this opportunity. I am humbled to be here in front of you, and then also just really want to thank everyone for coming and listening and being here. I think it's really important that at the end of this, we have as much discussion as you want to have about anything that we talk about. And so today I thought and reflected a lot about what we've got going on in front of us and where we are as a country and where we are as a global economy, a global world, and wanted to give you reflections on what I've had on my background over the past couple of years and what has given me the opportunity to be able to continue on, to thrive, and to be here in front of you today. So a little bit about me and my background. I'm a family medicine physician. You think about that in the context of what we've got going on around us, and you ask, how did a family medicine physician that does inpatient and outpatient care get thrown into the middle of leading a pandemic response? And it's a good question, one that I never thought I would have to face, and one that I thought that was way beyond me whenever I first got asked to be part of the group. So I'm going to take you back just a little bit to February of 2020. I had just recently accepted a role of being a medical director here at UNC Health for what we call our Clinical Contact Center, which if anytime you call UNC Health after hours, you talk to a nurse, that's our group of team. That job was crafted to say, we really just need some medical oversight on what we're doing as a nursing group. Should be a pretty straightforward and simple task. I don't imagine it taking much of your time. February of 2020, we're sitting in a room trying to figure out how we're going to come up with the response of what we're going to do as a healthcare system for the emerging COVID pandemic. Never have I been involved in infectious disease before that point. Never have I been involved in crafting and orchestrating a plan on an organizational level that was as wide as what UNC Health's footprint is, but was excited about the opportunity to help participate. And so from that moment, kind of went all in. Helped with my colleague in infectious disease, Dr. David Wall, who you probably have seen on TV almost every single day talking about the pandemic, start what we call our respiratory diagnostic centers across the state, and have been really the hubs of what we've done for testing as a healthcare system here at UNC, and was able to be a participant in starting and crafting what it could look like to be able to provide care, but then also what we would do as a group and as a healthcare system to keep our patients safe. And I was really proud of the opportunity to be involved in that work. And that spurred my opportunity to help craft what the university could look like when we were thinking about plans to come back in spring of 2021. Again, never worked in a clinical laboratory, never ran a PCR test in my life, but had enough background, I thought at the time, to take another chance, and helped with a great group of people to craft what we have right now, which is called the Carolina Together Testing Program, which to date has run over 240,000 tests on our college campus to keep our college community and the larger Chapel Hill area safe. I tell you all of that because this is a great point that I think we miss when we talk to each other. You hear about these things and you think, that's great, that's amazing, there's lots of success there, but we never talk about the things that got us to that point. All of the points that we talk about are the CV line items, not the points that we talk about where we had the failures in life, and what we needed in terms of successful groups and people to help build us up to get to that point. So for me, I took a time to think back about this, and throughout this entire experience, the person or the pillars that have been there for me are my immediate family. My wife is the most supportive person I could have ever asked for. So she, at the very beginning of this, said, you do what you need to do. This is your opportunity to go out there and use your background for good for the community. And if it means that we have to take a little bit of a backseat in terms of hours at your home, go for it. That was 2 months that I didn't hold my one-year-old that just turned 1 because we didn't know as a medical community what the chances were of COVID taking flight. We didn't know how severe the infections were. So the first 2 months didn't get a chance to be around her. My wife and I slept in separate rooms. I used a separate entrance when I came home, all the things that you probably saw on TV. That was our life for 2 months. And I thought that it would end and then carried through for 2 years. And then in the in-between time, one of the things that I think has been really helpful for me has been having one of the people that's on the screen here being a sounding board for me and reflecting with me. I've been lucky enough to be involved with Francis as a mentor, mentee, and the opportunity to sit down with someone who is a college-age student going through the pandemic at the same time that I am, and learning from them what it means to be an active and large member of our community was really something that gave me hope, gave me a sounding block to have some honest and candid conversations, and then also gave me an opportunity to be able to really, quite frankly, ask questions of advice from someone that I trusted and respected. So very much appreciated that Francis's love for me has spanned more than the walls of what we really were set up to do, which is to have a relationship of just being there together to listen to each other. I want to tell you this part of the story and the background because I think we're not unique in this situation. All of us have our pandemic stories. All of us have our moments of where we felt isolated at time. All of us have our moments where we have walked into a situation where we felt uncomfortable and took a chance on ourselves. And that was one thing that I really think has been very helpful for me during this time. Take a chance on yourself. Take a chance on who you are as a person and find those things that are really inspirational to you and really beneficial in making you who you are, and go out there and try. I was told actually by a lot of people that I trusted and that I really cared for, that gave me advice throughout my career in medicine, that taking on the opportunity to help lead the campus was a really, really risky opportunity. It's a big task with a lot of eyes that had a lot of potential downfall. But I thought that it would be a really good chance for me to say, if I can't help in this one moment, then what am I doing with the way that I think that my community should be served? So it gave me a chance to go out there and work hard to do something that I thought was really helpful. And I know that we all have that same opportunity and same chance. Find those moments that I think make us better. For me, that was walking in the Arboretum. I live 2 blocks from the Arboretum here at UNC. I've lived here for 6 years, and before 2 years ago, never walked through the Arboretum. It's crazy. I mean, it's like right in my back door. Never did it. And it's been one of the biggest joys that I have. And very frequently, I spend even just 30 minutes a day, even if I'm on a call for work, walking through the Arboretum. And I think that that's been really helpful for me. And then finally, I think one of the things that has been helpful and that I really encourage us all to do is when you're using those moments that you may have in an environment of learning, see how it can impact you and change you as an individual and as a person. So my relationship with Francis started because we wanted to work together to help her achieve goals. It was an opportunity that flourished into something different because it was an opportunity for us to sit down, be honest with each other, talk about what we thought we needed to do to help each other, and really has been a pillar of making us both succeed throughout this semester or throughout the past year and a half. So wouldn't have had that opportunity if it wasn't that chance to connect back to the Morehead-Cain Foundation, take a chance on each other, and then make sure that we had the best opportunity going forward. So with all that being said, 7 minutes isn't a lot of time to talk and to kind of reflect on the things that make us who we are, but it is an opportunity for us to at least start the conversation and open the door. So happy to hear more about you in terms of what you thought has been helpful for you to get through the pandemic, the things that you would like to learn more about how all of this came together for our university and our community, and what you see as us going forward. So thanks for giving me the chance to share a little bit about my story and the joys that I've had along a long way of trying to figure out the right path.
Thank you, Amir. Perfect setup. It's wonderful to have that background. And it looks like we have our first hand raised, and that is Francis. Thank you, Francis. Ask your question, if you will.
Sure. Wonderful 7 talk. First, I just we've talked about this a little bit, but I just thought it would be helpful maybe to hear a little bit about the time when, you mentioned it was the opportunity of a lifetime to step up and lead in a way that you felt like you had been positioned to do. And sort of that totally changed family balance. What gave you hope, or what was the thing that got you through, I guess, those months when you didn't know when is the point when this will be over, and when is the point when I can go back to like the family balance that I've been working towards?
Yeah, it's really, really tough. When we go through medical education, you always look forward to your first job out of residency, because you say, gosh, I've worked really hard to become done, and get to take the benefit of all these years of school, all these years of thinking, all these years of working through this to make myself, get to sit down and look at the rewards. And a lot of that for me pre-pandemic was spent on family activities, traveling with my family, being there with my wife, cooking at home, the things that we really like to do. So quite honestly, when we went and set up the Respiratory Diagnostic Center, it was right after my daughter turned 1. I took her with me. I took a picture. We're both smiling. And I thought, this will be over in 2 months, but I want her to be here with me and just see what this feels like. I couldn't be more wrong. I was way wrong. And so what we needed to do as a family unit was reassess. And Anna had been there from day 1. She had seen me through a lot of my struggles before. I talk very candidly to medical students about the struggles and how hard it sometimes is when you look at people and you say, gosh, it came easy to them. Well, you look at potential of a CV, for example, and mine says that I have a master's degree on top of my medical degree. What you don't see behind that master's degree is the 2 years that it took me to get into medical school because I didn't get accepted. And I had to find a way to work myself into a position to show people that I could do well on a graduate level course load for medical education. So I think a lot of that was always there with Anna. She's been there with me from when we started dating in college all the way through graduate and medical school. And she knew that this was important to me. So she was willing to sacrifice as much as I was willing to sacrifice. What we tried to do was slowly incorporate the rituals that made us happy and whole again. So the first few months we were open 7 days a week, and I was at the testing site 7 days a week. After our first few months, we decided weekends were off. So we really took advantage of Saturdays. We would run together to the farmer's market. We would sit in our front yard with like a table in between us. And sit and talk and have a glass of wine together. And we took advantage of that. And we made do with what we could. And slowly and surely after that, we just found ways to incorporate what was really important to us. I still managed to watch my children grow, which was really great. They still got to spend time with me, which was really great, sometimes from a distance, but now very, very much closely together. So we just really made it a point to try to find the things that made us happy and whole.
Other questions or stories, comments, things that got you through? I have something I'm curious about, just the timing. As you said, here you were suddenly thrust into the situation. And did you have to hire up, to staff up to make all this work, or how did that happen?
Yeah, great question. So we partnered across the system to say we need we have to get this done in a very quick fashion. Our first meeting to finding a site to starting testing was 2.5 weeks. So it wasn't a very long period of time. And actually the day before we ran the system that we're currently still running, where it's a drive-through based system, we joked about it because we had seen articles from South Korea that had shown that they were doing high yield testing in a drive-through fashion. And we said, oh man, that's funny. What if we did that? And we didn't have a model set up like that at the very beginning, but we decided to pivot very quickly when we saw how big this could get. So we borrowed from the healthcare system. We borrowed people from all across the healthcare system to assist us and to help us in our venture. And we partnered together, and I will tell you, I'd never worked with these people that I worked with at the Respiratory Diagnostic Center before, but there was a shared unity that we were going to make it through, and we were going to do this together for the good of the people of North Carolina. It's always a pillar of what UNC Health and School of Medicine does, is that we really buy into the notion that we're here to serve the people from the state of North Carolina. To a T, all the people that we worked with said that. And it was a really refreshing moment to say, gosh, this is it. We're here together. We're going to work together. And we became kind of a family unit. And it was an awesome experience to see.
Wonderful. Thanks for sharing that. Pam Oliver has a question for you.
Well, thanks, Amir, for sharing your story. I hope you can hear me. I'm driving back to Chapel Hill, actually. I think that what you've done is amazing. And I know it took a lot of motivating others to be part of the team, right? I mean, this was a scary time. We were asking people to, do things. We weren't sure exactly what that meant. How did you motivate your team, all those people? How did you get that army of people and get them to pivot along the way? Mm-hmm. What's your style, or what was your secret there?
Pam, that's a great question. I've always been part of a party that believes that leaders do the work. And so I never have asked anyone to do something that I wouldn't do. I trained myself in lab sciences as if I was one of our workers working in the lab. So I went through all of the training modules to be able to be a successful lab science tech, and to make sure that I was compliant with safety and regulation standards, just as if anybody that we were hiring to do it. I think that resonated a lot with the people that I was working with. But I also think that the other thing was that we had a really great team of shared leadership that we looked to each other to help each other out. One of the things that I think from the university perspective that has made our campus so helpful and so safe is that we have over 1,000 student volunteers in what's called the Carolina Student Service Corps that have spent over 24,000 volunteer hours in the past year helping keep our campus safe. I mean, 24,000 volunteer hours in 1 year by students across our campus. And when you see that, how can you not be motivated to make this place better? You've got so many people that are working together to do it. I think personally for me, it was making sure that people, it's very easy to say and be Pollyannic and say, we can do this and we'll figure out a way and get through it. I think a lot of times you also have to acknowledge the difficult points. And when it's hard, it's really hard. The first 2 weeks of the lab being open for the university and running tests, we were working, myself and our lab manager, Amy James Loftus, were in the lab 20 hours a day. So we were working from about 5 to 6 in the morning to midnight every single day, trying to make sure that we had all of the lab results come out. That was a really difficult task. I didn't see my family except for when I came home and went to bed. That was the only time I saw my wife, and I would leave before she would wake up. But we shared in that experience together. We worked together with our group of colleagues to say, we're here for you. We're ready to do this. We'll do the work. I wasn't afraid to bounce around and to do jobs such as picking up trash, to dropping off supplies, to making sure that people had lunch. Whatever it meant to keep our group going and to keep them motivated, I was happy to do. So I think that was a really great learning point for me, a point that I still think today was really helpful in making us so successful in what we have done, and one that I think I'll continue to carry over in my leadership style for years to come. I have to say there's a very special person that just popped into my screen here. And So this guy is a really important person to me because this is my father-in-law, David Ruth, is on the screen, and he is someone who has given his dedication and his soul to the university, and has been a really great father figure to me. But when you get a family member that you get to see that works as hard as he does, because he finds passion in giving back to the community that he serves, I don't want to be on the opposite end of the Thanksgiving table and be the person who doesn't succeed as much as he does in his job. So it makes it really easy to motivate and be competitive when you have good family members that work really hard as well. So in addition to allowing me to have a great family with his daughter, and I know that she learned some of those characteristics and some of those traits from him. So it's really an honor to even be in the same venue as he is.
Well, let me, I wasn't going to say anything. I've just been enjoying, I've been enjoying this, but a little embarrassed too of being on top of Amir because he's such a star in his own right. But two things real quickly. Amir wouldn't be in our lives if it weren't for the Morehead-Cain program. Him getting from Arlington, Texas to North Carolina probably just wouldn't have happened had it not been for this program. So I am forever in the debt of the Morehead-Cain program. Second, I was sitting in South Building, Central Administration Building one morning, and a leadership team meeting, and the provost and the chancellor were talking about how we were going to solve this problem of testing for the university. And they were talking about bringing somebody over from the healthcare side. I thought I had advocated for that. I thought that's such a good idea. I had no idea who they were getting ready to mention. And they said, the guy we've selected is Amir Barzin. And I'm sitting here thinking, I don't even know this. They didn't, thank goodness they didn't ask me, because that would have felt awkward. Amir didn't tell me, which is kind of typical Morehead-Cain character, right? I mean, we just lead, we don't wear it on our sleeves. But I had to say to my whole leadership team, out of full disclosure, to my other colleagues who I really love and didn't want to think anything was really up, I had to say, this is my son-in-law. And let me tell you, it has been such a joy to watch the outcomes from this leadership. And the one thing he said that I just want to emphasize, he leads by doing the work. And I see that every day. We see that every day. That's a pretty cool trait. So Amir, thank you, buddy. You motivate me.
Thank you for that, David. Awesome. And Chris Bradford has a question or comment for you, Amir.
I have a question, and it's a mirror of a question that I asked yesterday in the higher ed panel. And the backstory, for those of you who don't know, is that I moved from South Africa in June, and I'm basically an immigrant. I've lived overseas for 16 years, and then had a baby 3 weeks later. And so my first experience of America was trying to understand the health system, which is immensely complicated and very, very different from my experience on the other side of the world. And then I had the experience of getting COVID tests, which I've had several times now. And I mentioned this to you, Amir, when I saw you on the street. I've never experienced a more efficient healthcare process in my life than the one of going onto Hall Pass, getting my testing code, showing up, rapidly testing myself, and then receiving an email telling me my results are ready. And so, I've had these like vastly different experiences of the health system. I'm curious now to the question, how do you think the experience of COVID and the sort of operational challenges and new skills it's forced you and your team to develop, how do you think it's going to shape the way in which we deliver healthcare in the future once we get past this point?
Such a great question, considering where we are, but also where we want to be. So totally agree with you. There were things that were no-goes in medicine, absolutely off limits, because in the archaic structure of the way we provided care for the past 120 years here in the United States, picking up a phone and talking to a patient was not one. Doing a virtual visit was not one. And it's changed the infrastructure of how we do work. And so one thing that I think has happened that we really appreciate and we love now, there's a lot of efficiencies that are gained by working together in healthcare. For a lot of what we do in healthcare, we silo care, we distribute care in really distinct areas. You know, if you're an outpatient clinician, you really try to just focus on maybe potentially the outpatient work. If I'm an infectious disease doctor, I may not necessarily have that great of a relationship with my community partners that I work in primary care. It's totally gone now. It's one network. It's one group of people working together to try to figure out a common goal. We've got everyone from pediatricians to family medicine docs, to infectious disease docs, to pulmonologists, to nephrologists, to ethics professors working on how to better care for COVID. And they're all working on the same projects. It just wasn't common before in medicine. We didn't really break those walls down. So I'm really encouraged by our community in terms of what we do together as a group. But then the other part is our technology and being able to share developments, share care has totally changed. And I think what we realized is what we thought was really important for us as clinicians and providers, it's actually not what the patients want or need, you know? A lot of times, like what you described in terms of us making an efficient process for a test, if you ask Stephen King, who helped develop that, he viewed it as a consumer-based product for the patient user, right? The user satisfaction of what they were getting. He didn't view it as clinical care. He said, what is the best way for us to have the patient feel like they're walking into something, it's easy to use, and they're satisfied at the end. And it really took us to kind of look at it that way, to say, then this is how we need to go about it and develop it. I think we're doing that better now in medicine. It's not this high up structure where the top is the clinician or the provider that's providing the care. This is a team-based approach that everyone has equal say, and we really need to formulate the best plan. And this is different than what we had. I'm really glad, because I think it fits the bucket and fits the boat of what other industries have done for many, many years and done really, really well. The other thing that I think has been really great that we're going to carry forward, this whole past 2 years of the pandemic has been a really big quality improvement project. We are continually assessing, changing, keeping up with guidelines, changing the way we do treatments, re-educating ourselves, re-educating the community. And we don't necessarily do that as quickly or as rapidly in medicine as we should. And I think this has been a great chance for us to show what we can do when we work together and really do it the right way. So I wouldn't be surprised if lean methodology and lean principles becomes a pillar in what we do in medical school education going forward. I sure wouldn't be surprised if our group working together as clinicians does shared team decision-making much more than what we did before. So I'm hopeful that those components will carry over and will be really impactful for the way that we restructure care. I'm biased to an extent because now I'm the medical director for virtual care. So I'm all in on new innovation and design. You know, I'm going to do this and I'm going to try to find the most effective way to make that happen for our healthcare system and for people across the state. But I think that it really is a new avenue for us in medicine to be able to provide care.
Thank you for that, Amir. And I do have to say, I think Chris walked to his test appointments every time. I had to drive once. I came from home. And I know you were able to get all of the medical and healthcare people to work in tandem, but I don't know how you got the parking people to do it. But there was plenty of COVID testing parking. So, wow, on a college campus, that's impressive. So
I think that was my most amazing feat, getting parking to commit to giving us parking spots. That was, when they offered, I was like, yeah. This is incredible.
it was magical. Just to try. No, I do also have an anonymous question that someone has direct messaged me for you. Let me read it to you real quick. Amir, can you speak more about not getting into medical school the first time? Imposter syndrome and mental health is at the forefront of so many discussions these days, and it would help me and probably many on this call to hear more about that circumstance and how you made your way through it.
Yeah, absolutely. So one point to clarify, it was actually 2 times. So I got into medical school my 3rd time of applying. So very important point, because it really changed the way I viewed myself. So one point that I had, when we go through life, I think a lot of what I was going through at the time when I first applied to medical school is that it was kind of like a stepwise planned pathway that I felt like was just the next step, right? So you apply to medical school and you get in. Well, that's not what happens. You've got to really put in a lot of work and a lot of effort to make sure that your applications are complete, your test work is great, and that you show that you're a solid, well-rounded applicant. I think I took for granted that first notion a lot. I think that I felt like I had a well-rounded application. I was average MCAT score for acceptance. Like if you looked at my year of acceptance into medical school, my MCAT score was the 50th percentile. My science GPA was the 50th percentile. My non-science GPA was like the 60th percentile. So I mean, pretty consistently across the board average. And I realized very quickly that, I had to make a decision. This was my fork in the road. Am I going to continue down this path, knowing that it's a lot of years of education and commitment to this down the line? Or do I divert? And my diverting path was culinary school. So I was thinking very much about being a chef and going the route of culinary school. So I gave myself the opportunity to say, like, how do I get better at what I'm doing here? And I sat down with the people in the admissions committee. They said, your science GPA could be brought up, and I would encourage you looking into master's programs to show that you can do graduate level work. Took that to heart, and that's what I did my second year. I worked as an EMT for a year before that, so I got kind of more clinical experience, got my hands wet with clinical experience to a degree that now looking back on it, I see a lot of the students that are applying and getting accepted to medical school, they have that clinical experience. So I got my clinical background, I got my educational background, and I really, quite honestly, retrained my thinking. I dedicated myself to a full-time job when I was in graduate school. I said, if I was working as an EMT, I would be doing an 8 to 7 shift, 5 days a week. And that was my job. So why can't I do that in school? So 8 o'clock in the morning, would go to class. Classes were over by noon or so. Then I would spend the rest of the day studying, just like it was my job. And I had to kind of retrain myself. But that was my point where I decided, if I'm excited about making this commitment, this is the field that I want to be in. And so one of the reasons why I was thrilled in the aftermath of all of this is, and I tell our students and our residents this, I'm not unique in the story that I have in medical school. There's hundreds of people that have done that. What I think is unique is that you have a decision when you walk into work to whether you say, I'm going to make the best of this situation, or I'm going to be upset because the day didn't go as well as I wanted it to. My patients were 45 minutes late and I had to stay over. I think it's a really big privilege that we have to be clinicians. And I try to encourage our residents to take every day as one where there's 1,000 of me that would have loved the opportunity to have a patient run late, that never gets that opportunity to be in medical school. So those were my learning points. I try to instill that in education and to be a compassionate and caring doctor going forward. And I hope that that resonates with our learners that we have across the board.
Wonderful, thank you. It's great. Tom Morris, whose title is now Fan of Amir, I love that, has a question for you.
Thank you, first of all, Amir, for all the amazing sacrifice you've made and the incredible leadership during what a difficult time. I have kind of an unusual question. I'm not even sure how to ask it, but having gotten into medicine and seeing this rising tide of pandemic all around you, early in 2020, that's a challenge enough for anybody. But I was wondering if you also felt during any of this time the additional challenge of the cultural headwinds that may or may not have been a part of any other comparable epidemiological event in human history. I see people on social media, healthcare professionals in various parts of the country, saying that they've been advised by their hospitals to take off their scrubs before they leave the building and not to tell anyone they're in healthcare, whether they're nurses or doctors. what a bizarre cultural time when you've had to devote so much energy to fighting the pandemic itself. I was wondering if you just had to block out all that cultural stuff swirling around, or if it somehow seeped through your daily regimen and affected you in any way in terms of your emotions, your attitudes, your perspectives on what you were working so hard to do and in a very difficult time.
Yeah, it's a really interesting reflection because I am inherently a person that lets things kind of roll off my shoulders. And knowing that I am giving the best that I have to be able to help. When you talk about what you mentioned, it is really a striking contrast in terms of what we have available to us. I felt for the first time in my career that I really had to persuade people that a doctor's opinion was a good one. And I'm a shared decision maker with my patients. I say, here are the opportunities. I will never give them a bad opportunity. I will say, here are the 5 choices. Tell me which one sounds good to you. But to have people, like you said, afraid to walk out in scrubs or say that you're a clinician or a physician in your community, that's a tough thing. I think it really wore deep, and it still is wearing deep. We have a massive healthcare shortage right now. It's really tough. And I think that fatigue, I think that a little bit of the feeling that the work is not appreciated has been setting in. I think for myself, I use that as a, for better word or not, catalyst to make me work harder in what I thought was a really important task. I've never, ever, no matter how many people I see in my continuity panel, I would never have the ability to impact the lives of 30,000 students, 20,000 university community members, a county that I live in that has 65,000 people right here in Chapel Hill, and then larger in Orange County, and then be able to disseminate academic pieces of work that others can use as a groundwork. We wrote on how we set up our respiratory diagnostic centers, and that was used as a platform for others to be able to do testing across the country. To me, that was worth it. That was it, right? Being there to help people in a time of need. That was my motivating factor. So I kind of blunted the noise around me when it came to points that you were talking about. But I definitely can see and appreciate how that can make an impact on others that are going through it.
Thanks.
Thank you, Tom. Good question. Jim Stratton has a question for you, Amir.
Actually, I had a comment responding to what Tom and Amir are both talking about. When I was a med student at Chapel Hill as a Morehead-Cain medical fellow, I did a clinical rotation down at the Centers for Disease Control in Atlanta because the most interesting medical school professors at Chapel Hill had all worked in the public health service, usually for CDC. Some of them had been up at the NIH. And I got really interested in that and ultimately had a career in public health rather than clinical medicine. And along the way, ended up as the state health officer in California for about 4 years under 2 different governors. And this pandemic has been a slow motion train wreck from the get-go. The federal government had a pandemic response plan that they had on paper, but did not have in practice. And the then Trump administration decided that they were going to turf it all to the states who were not prepared. They've been under-resourced for years. At the end of World War II, approximately 40% of the healthcare budget went to public health departments. These days, it's low single digit in terms of resources. And a problem will come along, there'll be some short-term funding for a few years, and then it just all goes away. In my state, Governor Newsom hired a crackerjack state epidemiologist, health director, public health director out of New York City. And 3 months into the pandemic, fired her over issues with the database that she had nothing to do with and had been created prior to her arrival there. And so it took a long time for the good governor to find another state public health director, and ultimately hired somebody who had worked for him when he was mayor of San Francisco. But at the county level, it's even worse because you've got some small town politicians up in Placer County, which is just east of Sacramento, where I live. The Board of Supervisors overruled the county health officers' quarantine and mask mandates. And so she resigned, left the red county and went to work for a blue county where her word and information is expected. I myself had been out of the game for so long, I did not get back involved. But so my personal, solace during this whole thing is to be staying really on top of the latest science and staying in communication with a dozen or so of my epidemiology colleagues, commenting on just how mismanaged things have been. One of the real cardinal sins of this entire pandemic is the failure to figure out how to get kids back to school a lot sooner than we did. And it's just going to be a tragedy for those kids with a permanent hole in their education. So I hope many of you are in positions of influence, but if you can, make sure that we actually learn something this time and prepare not for the short term, but for the long haul, because this particular virus is by no means the worst that can happen. And the more we push into wild lands around the world, the more we eat animals that are not domestically raised, the more likely it is that we'll have more of these, not less of it. So we need to do much, much better. I'm done.
Thank you, Jim. Appreciate all that. Ryan Jensen, class of 2024, has a question for you, and you're next.
Hey, yeah. I'm just wondering, like with most medical shadowing pause, I know like the whole UNC hospital system or shadowing programs on pause right now. What are some ways that pre-med undergraduates can look to try to get clinical or just healthcare experience that aren't related to COVID?
Yeah, Ryan, this has been a big point of discussion with us in medical education. I feel so bad for students in your position, and then also for our residents. There was about a year's worth, a year and a half worth of hands-on experience in patient care that they didn't get to participate in. And it's a really big gap in terms of being able to, in a field where repetition and being able to see normal 100 times makes you appreciate that one time you see abnormal. Every single patient encounter is a valuable one. So what you bring up is a really great point. I encourage students in terms of being able to just reach out to people, if it's not even in a clinical environment, at least finding someone who's willing to help talk to you and kind of mentor you through the process of what it means to provide medical care. There's lots of really interesting opportunities that have come up with things like, for example, locally, the Carolina Student Service Corps is now actually bridging into hospital-based care because of the shortages that there are in the hospital, and being able to help with things like vaccine assessment, being able to help with things such as monoclonal antibody work. There's a lot of really interesting opportunities out there. A lot of this is also built into the fact that I think what we need to do better as clinical educators or as peers, as groups, lift up the opportunities that we see to help students and support students. And like I mentioned with my relationship with Frances, a lot of it is not me giving her insight into how best she should apply or what her paragraph should be for her personal statement. But what are we going to do whenever you get into medical school that'll make you happy? what are the things that we can set forward for you right now? What's the infrastructure we can build that gives you a process to follow in your years that you're going to have that are going to come after this, that's going to make you succeed and make you sure that you're still happy, make sure that you still have a meaningful relationship with those around you. So it's a lot to offer. A lot of it is just a little bit of it, not necessarily tied into directly in the medical world, but I think it makes us better. And I'm quite honestly, I would much rather read that on an application for someone who's applying as a resident or as a medical student than someone who's had 100 hours of benchside work or clinical work that they really don't feel passionate about, but they were doing it just because they felt like they needed to make sure they had some clinical experience. So like, I think a lot of it is also tied in with the story that you tell.
Thanks.
Thanks, Ryan. We have time for one more, and I think Tom Morris will wrap us up, which is appropriate. We often ask Tom to wrap us up at the forum, so this is perfect for this evening.
You know, I once had to apologize to a professor at Yale in graduate school for asking too many questions, so I've tried to hold it down today. But Amir, here, despite the fact that you've already admitted to us, you've confessed that sometimes your crystal ball is not working properly for prognosticating the future. I just thought a number of us might be interested in hearing how you see the coming months that we'll be facing here in this country, because there are a lot of us who are being asked to travel for the first time in 2 years. You know, I used to be on 400 to 500 airplanes a year in a normal year, and I haven't traveled in 2 years. So how do you see things playing out now? Do you have any feelings about whether things will wane or whether we're going to have a big surge from the holidays? What's it like in your crystal ball today?
Yeah, so I'm going to shake it and then we'll, take a peer and look in. But I honestly think that where we are right now, we have the infrastructure to understand the difference between the mind frame of being in a pandemic and then being in an endemic state in an endemic environment. I don't think that we will ever get to the point where we chase zero. Chasing zero, I think, is a really just untangible goal. We will never get to the point where caseloads will be zero. But what I do believe that we've set ourselves up for a lot better than where we were, let's say, a year ago, and for sure 2 years ago. We have mitigation efforts that really help make sure that people don't end up with severe disease. So we've to date have seen that vaccinations really help in preventing severe disease. Can you still get COVID? Yes, but your chances of ending up in the hospital or with severe disease are a lot lower. We've made unbelievable strides in treatment. We used at the very beginning of the pandemic, one of my friends who's a plastic surgeon was one of the ones who got called when he was in New York and said, now you're working in an ICU, and he would come home every day and throw his hands in the air. Say, I don't know what to do for these people. I have nothing to offer them that I'm throwing a bunch of things that we think maybe could work. Where we are right now with monoclonal antibodies, where we are right now with potential oral treatments is just a world of difference to where we were before. So I think what we will see is potential for cases to rise to a plateau level, a little bit higher than where we are right now, at least here locally and in the United States. But we have a lot better treatment options to keep people safe out of the hospital and hopefully curb mortality, which is really, for me as a clinician, is very, very important. That's like my big goal.
Wonderful, thank you. And thank you so much, Amir, for sharing your wisdom and your warmth and your authenticity with the group this afternoon. And thank you, of course, for all you've done and given up to help keep the Carolina campus and the surrounding community and the whole state really safe during COVID. What a wonderful 7 talk. Thank you so much.
Thank you, everyone. Thank you for taking the time to spend your hour with me. I really appreciate it. It's great to see everyone.
And we hope you all can join us tomorrow night for Kevin Callahan's holiday cooking demonstration and wine pairing. Amir was going to maybe be a chef, so now we'll have a chef tomorrow night. So it's going to be delicious. So we hope to see you all there. Thanks a lot. Good night, y'all. Amir, you can go pick up your daughter. So great.